So I wanted to put together a quick video on how to build behavioral health into your first responder agency. I wanted to do this because I've seen a trend over the past several years of first responder or emergency services organizations starting to think about behavioral and mental health and start to think about behavioral and mental health programs. I think this is great. I think it's past due. I think this benefits the membership. It benefits the organization as a whole. And I think that this trend is going to continue. So what I think we're going to see over the next several years is lots of organizations thinking seriously about implementing behavioral and mental health programs into their organizations and starting to do so. But what I'm worried is that after a few years, lots of these programs may kind of stall out. They may fail outright. And I don't think it's because people don't care about these things. I really think people do, and increasingly so. I think what happens is, historically, the way we've treated behavioral and mental health in first responder emergency services worlds is we've kind of treated them as a sort of add-on. And you can't take your behavioral health programs and treat them sort of this random grab bag of programs and initiatives. If you want behavioral health to succeed in your agency, you have to see it as part of a behavioral health system. It's really woven into the day-to-day functioning of the organization. And this doesn't matter what type of organization I'm talking about. It could be fire, it could be EMS, it could be law enforcement, it could be career, volunteer, hybrid models. The details are going to change, but the underlying principle is the same. If you want your behavioral health programs to succeed, you have to treat them as part of a behavioral health system that is an integral part of the day-to-day operations of your agency. And that's what I want to talk about today. So I kind of broken this up into two parts. The first part is to think about doing a behavioral health audit, and that is today, where are you now? What does your organization or your agency look like in terms of behavioral health and integration into the organization? And then based on the results of that audit, what do you need to do to move yourself forward as an agency or organization? And that's more of this implementation process. So what I hope is by the end of the video, you should be able to complete this audit of your agency and then to begin to implement this structured behavioral health program. This is really designed for you to use as a framework or a template to assess your agency and really think about how to develop the strategic implementation plan. So let's start with an audit, a behavioral health audit. And again, this is really designed to say, where are we today in terms of behavioral health programs and behavioral health integration? And I'm going to kind of give you some steps, just work through these steps and stop as needed to really work through each one of them. You're probably going to need to get some feedback from multiple people to really do a good job of this. But these are the 6 main areas I think that are important to look at if you're looking at really, again, systematically integrating behavioral health into an organization. And for the first one I want to talk about is culture. And I want to talk about leadership and stigma as aspects of culture that are particularly important. Right? So the first thing to think about when we think about the culture, the underlying culture of your agency or organization in terms of thinking about behavioral or mental health. And it's just do you think right now, today, that all levels of the organization support mental and behavioral health, particularly the leadership? And when I say the leadership, I mean structurally in terms of the organizational chart, the leadership. But I also mean, I like to call them the cool kids. I think of them as your influencers, right? The people, and you probably know who they are, right? They've got this outsized influence on the opinions, or their opinions are seen more or taken very seriously in organizations, right? They have influence. And again, this is just about assessing where you are now. And do you think that, if you will, your influencers are on board with implementing some of these programs? If leadership and your organizational chart and your influencers, your cool kids are on board, that's great. If they're not, you might have a little bit more work to do. The other thing I want you to sort of think about is whether or not mental health issues and mental health treatment are stigmatized. There's been some recent surveys suggesting that the majority of first responders across the board do think that they would be treated differently if they admitted to having mental health issues or needing mental health treatment. So that's something to look at, again, just to kind of see where you are with your organization. The next thing I want to talk about is what policies you have in place for mental health and behavioral health. I know people tend to use the terms interchangeably. I think behavioral health is the bigger overarching term. That's why I tend to use it. It includes mental health, but it also includes things like physical health, sleep and fatigue. We'll talk about some of those things. So again, this is just looking at what policies you have as of today in your organization. So here's just some things to think about. So first thing I'll say is, grab your binder or your webpage or wherever you keep all of your SOPs, SOGs, and look through them to see how many of them relate to behavioral health, mental health. And so again, just some stuff to think about. First of all, do you have a overarching SOP, SOG policy that says we support mental and behavioral health in this organization? Right? No details necessarily, but just somewhere it's written down in a foundational document that you care about this stuff. And I think you got to have one of those. So first thing to check is whether you have one of those. The next one is what policies you have in place, or SOPs, SOGs, on mental and behavioral health evaluation and support. So do you monitor the mental and behavioral health of your members? Most agencies, at least I think a majority of agencies, have annual physicals, right? So we have these, we do annual physical monitoring of our members, but do we do mental health monitoring? Do you have policies in place for fitness for duty evaluations? Are there some steps you could take, or some yardsticks you have to measure whether or not a person needs to be removed from work for a while? And if so, if they have to leave work, do you have a process in place for them to be able to return to work? Again, this is, I say work, even if this is a volunteer organization, you need some sort of policy there. Also, do you have an EAP program? If so, do members know about it? Do they know how to access it? Do you have a referral process for mental health professionals? If so, is this written down anywhere in a policy or SOP or SOG? In particular, do you have a policy for substance use? And I think this is one that most agencies have. Even if it's something as simple as no substance use X hours before you go on a shift or come to work. So that's what I think we typically do pretty good at across the board. You could go into more detail on this, but do you even have a policy on this? Also, I said that behavioral health includes physical health. The one in particular is, do you have policies on fatigue and sleep? Do you have policies on, do you assess and monitor fatigue in your members? Do you have rules about only working X number of hours in a row, particularly if people are being mandated or do overtime or pick up shifts or swap shifts or something like that? Do you have any ongoing policies on physical activity? Or SOPs or SOGs on how much physical activity you're sort of, if not requiring, at least suggesting people get. Also, do you have a peer support team? Do you have a crisis team? These are not necessarily the same things, but if you do you have policies on how people can become members of those teams? What kind of training do you do? Particularly in terms of a crisis team, do you have policies in place or SOPs or SOGs on how they get activated and deactivated? What are their scope of duties? These are just some things to think about. This is sort of a brainstorming process, but flip through all of your SOPs, SOGs, and see which of them relate to, if any, behavioral and mental health. So after that, I want you to think about your organizational chart, and I'm going to refer to something that I'm going to call the behavioral health director. I'll go in details on this in just a couple of minutes, but the point here is that you need an individual in charge of behavioral health. Right? That is a key part of this process. So right now, who is in charge? If you have any behavioral health programs in place, who is in charge of them? Right? If you don't have anything in place, do you have someone that you anticipate will be in charge? So is there a person in your current organizational chart who either is, or you plan, or you think they might be in charge of these programs? And one thing is, how invested are they? Something I see sometimes is people say, hey, we're going to put a peer support team in place. You're now the peer support administrator. And that person may not have a lot of interest in that program. So one thing you want to ask yourself is, if you've got somebody there or you're planning on putting somebody into that role, do they really want to be in that role? And also, do they have any other duties? So, is this going to be the 14th thing that's now on their plate that they're already feeling pretty overwhelmed and they just can't give it the time and energy that it deserves? Versus somebody who's really their only main job is thinking about behavioral and mental health programs within the agency. So again, just where are you now? And if you've been thinking about putting these things in place, have you thought about these issues? Finally, let's talk about your current resources. Right? I'm going to talk about any current teams that you have, some initiatives, and some referrals. So in terms of current resources, do you have a critical incident team? Right? Do you have an agency team or organizational team? A lot of times these are at the county level. So does your county have a team or your region have a team? That's a resource you can use, and lots of people do use. Do you have a peer support team? Again, peer support team, critical incident team, not necessarily the same thing. But if so, same thing. Do you have a peer support team within your agency? Do you have a county team, regional team? Again, resources you can use. Do you have a chaplain? Chaplains could be a really integral part of a behavioral health system if you've got one. Do you have currently any existing wellness programs? Do you have, do a discount for gym membership? Do you have any sorts of, do you have a yoga, somebody comes in and does yoga with membership? Anything like that. Those are all resources that you can kind of think about building on. Again, do you have an EAP program? If so, do you like it? Would you like to sort of try to integrate that more into the operations of your organization? But again, a resource you can use and leverage to building part of the system. The last one I highlighted, it's do you have current mental health referrals? And this is one that I see a lot of places struggle with, and we'll talk a little bit about this with implementation. But just right now, if you had one of your members come to you in crisis and said, I would like to talk to a therapist, do you have a number for them, or a name for them that's kind of been vetted by your agency or not? And from there, let's talk about training. So we've talked about some of these teams, and in particular, how often do you train them? So just more broadly, how often do you offer training on behavioral health topics? I know, for instance, like EMS organizations, many people to keep their EMS, their EMT, or their medic certificate, they've got to do some continuing education on behavioral health. Usually not very much, but is that something that you do offer at least periodically? Do you offer some of this more specialty training, or have it made available to members? So peer support team membership, do you train that? If you've got a peer support team, or again a CISM team or a crisis team, how often do people retrain on that? Do you do quarterly meetings as part of this, or every month, every 6 months? How often would you like to offer training? So, right, if we're kind of this is where we are today as part of our audit. Do you have a sense of how you would like to build an ongoing training process? And again, on what topics, right? Would you like to start a peer support team? And if so, how are we going to do that? Do you want to do monthly behavioral health topics? Just think about brainstorming a little bit about where you'd like to go. And then finally, monitoring. And I mentioned this a little bit under your policies. But one of the things to start thinking about is how often do you monitor or assess physical health? Right? As I said, many, if not most, agencies have some sort of annual physical that they would like members to do. But again, do you offer a mental health monitoring? Right? Do you look at whether or not your members are depressed, have PTSD, are suicidal, things like that? Do you have any way to measure that? And do you have anything in terms of, in particular, measuring fatigue, right? Because fatigue is a really significant problem in emergency services. Do you ever do any monitoring of that? And should you make this mandatory, right? So in many places, that annual physical is mandatory to be part of your ongoing employment or membership in the organization. Do we want to do the same thing for mental health? Again, something to think about. We'll talk about that a little bit more under implementation. Because that's where I really want to go now is if you've taken the time to walk through these steps, those are again what I think of as the main areas for thinking about mental and behavioral health if you want to have them woven into and be an integral part of your agency. So if you kind of know where you are now, the next step is, well, where do we go from here? How do we think about putting sort of best practices into place? Right? And this may be a little bit of work for some of you watching this. It may be a lot of work. It may take several years, but at least you're going to, hopefully at the end of this, you'll have a roadmap for some of that stuff. So I'm going to kind of think about this as a step-by-step process. This is, you don't have to follow the steps in this order. This is, I think, a helpful order to think about, but you can do it in any order you want. I think you should probably at some point hit all of these, But as long as you're hitting them, I think you're on your way to building your own roadmap. So the first thing I'm going to talk about is culture, right? And I do think that I call working on culture step 0, because in some ways, if you don't get the culture piece, the rest of it doesn't matter as much, right? It's sort of the foundation of all of this. And reform and it's just a non-starter, right? If you're getting pushback from the chiefs or your board, or you've got, like, again, your kind of cool kids, your influencers are making jokes about it and telling people not to volunteer for your peer support team, or to only people are going to think less of you if you use if you go to a therapist. That's really going to make it difficult to kind of keep these things going, and one of the main ways I think they falter. Right. So a couple ways to do that is really, I say, co-opt the cool kids. Right. You might have to sit your influencers down. If they're supportive, great. Really tell them, hey, we're gonna really try to put behavioral health and make that a piece of the organization. I need your help. I need you to start, if you will, talking this stuff up. And if your cool kids are not supportive, I think one of the things you can say to them is, hey, at the very least, don't talk down about this stuff. Right? If you can't say anything nice, don't say anything at all, that sort of approach. But I think having kind of your most influential people in your organization either actively pushing for these things and kind of vocally and visibly advocating for these kinds of programs and changes, I think that's great. But if you don't, at least tell them to at least not make a lot of negative noise about it. Right? Another thing you can do is get new hires on board from the beginning. Again, if you're volunteers, new members that join. But I think talking about behavioral and mental health should be something you do in your onboarding process, so that when those new hires get into place, they think of that mental and behavioral health as being an integral part of the organization, so that they see that from day one. And I think it sends a message that you care about this stuff and that you care about it sustaining this stuff if you're talking about it from day one. And that's just a part of this broader organizational commitment, right? You can't say, hey, we're going to do this. We're going to start a peer support team. We're going to build these various wellness initiatives, and then really not give it more than a poster on the wall, right? You have to repeatedly, if you're a leader in your organization, you have to repeatedly demonstrate with your behavior that you actually care about these things. So you can't just give them lip service, and and you can do that in a lot of ways. And slowly but surely, you can change that culture. The goal is the culture of support. Right? If you get that, everything is great. It makes all the other steps easy. If you don't have this, it's really, really difficult to move past this stage. So some of you may spend some time working on this, or coming back, as we'll see, coming back to this. And this may be a long-term project. Hopefully, I think we've started to move in that direction as first responder emergency services entities to being more supportive of mental and behavioral health. So hopefully this isn't too much of a heavy lift for you, but that really is the goal. The foundation of all of this is getting that culture of support for mental and behavioral health. And I'm going to say this about every step. One thing I do want you to think about is, what are your current obstacles, right? Do you have one really vocal, cynical person in your organization that talks poorly about mental health, and sort of criticizes any mention of this stuff? That might be an obstacle. So I'm a big fan of the pre-plan, right? So if you know this is going to be an obstacle, start to work from day one of your implementation. Okay, how are we going to work around that? So this focusing on culture is going to kind of filter through this whole process. That's why I said it's kind of step 0. But the first concrete thing to do is, as you're starting to work on your culture, is you want to kind of think about your behavioral health director. Right? Hire that person or appoint that person who's going to be in charge of mental and behavioral health. I call them a behavioral health director because that's a term I happen to like. But do you call this a resilience officer? Sure. Safety officer, and I know that's in some organizations. I don't know that is broad enough. But whatever you title them, that's sort of irrelevant. The idea is that you have to have an individual who is responsible for this. So a couple things I think you want to think about when you're doing this is, it has to be somebody at administrative level, and they have to have some level of authority. Right? This authority piece may be the hardest part for you. If you've already got something in your organizational chart where you can fit that in, great. If you've got to start to add a person to your organizational chart, especially at the administrative, authoritative level, some people may give you some pushback on that. But I think that you do need one person who has the ability to write policies, write SOPs, SOGs. They may need to be approved by other people, but they should be the person who's responsible for the day-to-day functioning of this stuff and kind of QI and slow improvement of all these things, right? So they're the person that's responsible for these programs and initiatives relating to behavioral health. Again, both physical and mental, right? That's what you want to look at, both of those things. So again, think about your obstacles right now. As I said, the biggest obstacle I see is more administrative. Just where do we put this person in the chart? How do we give them authority? Who can veto them, if anyone? Especially if funding is involved. How are they going to get stuff approved? So think about what those might be for your organization. The next one is now that you've got a person in charge, that person can start to think about the policies, right? So we want to develop those policies, right? Again, all those policies listed earlier, hopefully you've got some of those in place. Every organization is a little bit different. Again, depending on your type of organization, depending on whether you're fire, your EMS, your law enforcement, career agencies, volunteer agencies have different structures. And so I don't have a thorough list of all the policies you need, but I hope in that first part of the audit, I gave you some brainstorming things to think about, right? And you want to think about how you prioritize these things, how long it's going to take you to roll them out is really going to depend on the particulars of your agency. But once you have a person in charge, I think the first thing they do is get your policies in order, because as we know, if it's not written down in an SOP or SOG, it doesn't exist. And so that will really give you it tells the organization that you're serious about this stuff. You take the time out to make a policy on it, and it gives you something to look back on and use as your structure. So again, what are your obstacles? The main obstacles I see around policies are the language of the policies. What I could suggest you do is ask fellow agencies around you. Like I said, people have been starting to put these things in place, and there are some models out there, some templates for being able to look at policies on sleep and fatigue, and policies on how to get to a higher level of care for mental health. So if you're struggling with the wording, you could always sort of ask around. The other one I think of is how do we get these approved? And that's almost always a process in organization. It's not a hard process, but it is a process. So you can kind of think of that as an obstacle as well. And then from there, now that you've got some policies in place, one of the policies I think you need to specifically do is think about monitoring. Right? And so like I said, many agencies, organizations have physical health, an annual physical at the very least. But how often should you do your mental health monitoring? And a lot of controversy around this, right? Because if you think about someone going to an annual physical, if they, if they're slowly developing heart disease or diabetes, we'll probably catch that in an annual physical, and it's not progressing so rapidly that, at least in most cases, that we're going to miss it, and it's going to be significant from one year to the next, right? It's a slow process. On the other hand, someone could go in for their mental health screening, their yearly mental health screening on a Monday, and on Tuesday have some major life crisis that really has a significant impact on their mental health. So I don't have a really good answer for this. I think at the very least you should be doing this yearly, but one of the things you can do is actually make mental health screening available continuously, if you will. You can put some mental health screening questionnaires online to be answered anonymously. There's plenty of freely available mental health screening tools out there that you can put online. You could set up a scoring process and that people could score them themselves. That way they can monitor themselves. What domains should you look at? I just put these up because these are the ones I think I see most commonly people caring about in first responder worlds. There are depression, suicidality, substance use, typically alcohol use, but we look at substance use, maybe marijuana use if you're in a state where that's legal, PTSD, and sleep and fatigue. Again, thankfully, there are very well validated, free to use, brief screening measures for all of these issues, and you could use them as needed. I will give at the end of this, I'll give you my email address. If you would like, I can send you these. We can talk a little bit about how to put them into an online screening format so that members could use them. But you may have other domains that you find interesting as well that you really want to also assess. But these, I think, are kind of the minimum we want to look at for first responders, given the high rates of depression, suicidality, substance use, PTSD, and sleep and fatigue problems. Again, what are your obstacles? Like I said, the largest obstacle is practical, thinking about how often you want to do this. Do you make it mandatory? How do you get this out to your membership? And once they get the feedback, what do they do about it? Those are kind of the big obstacles. We'll talk about some of that part of it in just a second. All right, so now you got a person in charge. You've got your policies. You're writing your policies. You're getting them in place. You're starting to think about monitoring the members of your organization for their mental health and behavioral health. Now you want to think about any systematic initiatives to put in place. So this is what I think you do next, right? And these should come from policy, right? They're driven by your SOPs, your SOGs. I think a couple of examples, right? So you could think about kind of in a broad sense, behavioral health, encouraging healthy behavior. You might say, hey, we really need to focus on that. So we're going to give people, discount on a gym membership, or we're going to buy some exercise equipment, put it in the station. Fatigue management in particular, I think is going to be really important. Have some hard decisions in your organization about shifts and overtime and mandating and some other things around that. Again, no one solution to any of those, but that might be something that you think of as particularly important in your agency. You might have some problem. I see this in EMS agencies, injury management. You got people, a lot of low back injuries due to poor lifting and moving. So thinking about some initiative related to injury management. Right? The other one might be encouraging the use of mental health services. Right? Do you want that to make an initiative? Make an initiative on that. Do you want to start a peer support program as part of that? Really depends on, based on your audit, what you think are the most pressing needs for your agency. Right? And again, think about obstacles. Mainly this is around time and money, right? How are we going to set up a peer support program? It's going to cost us money to give people money back for if they join a gym membership. Those are the kinds of things that I see a lot in terms of obstacles to implementation. But it really is going to kind of depend on what the nature of that actual initiative that you're trying to do. And the next, as you're starting to think about these initiatives, you got all this stuff in place. Now you want to start to think about training. So here's a couple things to think about. Regular CMEs on behavioral health topics, right? Again, the place I see this happen a lot is in terms of EMS. A lot of places require some degree of CME, some number of hours on behavioral health topics, mental health of the provider. But the other things we'll often see is special training, right? The two that are probably the most relevant are, again, a peer support team and a critical incident team. Again, not the same thing. They overlap a little bit, but they're not identical. The thing that's really important for all of this is it cannot be a one and done. These cannot be hey, we checked that box on mental health because we had that person come in and give a 1 hour talk on it, every January, and so that's done, right? There really has to be ongoing training in these issues, ongoing discussion of these issues. If you don't train it regularly, you're sending a signal that it's not a priority, right? The other thing is that you see with like the peer support team or the critical incident team, these are skills that will that need practice, right? And so regular practice in these skills might be necessary as part of that training, like ongoing training. Again, whatever you do, don't think that I've checked that box, I've done it this year's mental health training, that one and done kind of approach is going to work, because it just doesn't for mental health, right? So the obstacles I see here are time and competing priorities. So if you start doing regular mental health or behavioral health topics, that means you're not doing CMEs and other topics that week. And so I know there's a lot of competing priorities for all of our agencies. We've got a lot of things to cover, probably already too many things to cover. But if you want this to be important and you want this to be a priority in your organization, it has to be a regular part of the organization. So how you fit that in, that training in around all the other training needs, is often an obstacle. And then the last step, really last thing to think about, is referrals. And in particular, like I said earlier, I think this has been a real struggle for a lot of first responder agencies. Okay, someone needs a higher level of care. I think someone needs to be to go talk to somebody besides the peer support team. What do we do? And I'll just give you some suggestions. The first is EAP. Many agencies have an EAP. EAP may not be your go-to for long-term mental health care, but EAP can serve as a bridge. They can do assessments. They often have referral sources. That might be your first step, particularly if you're already paying for one in your organization. The other one is start to look for lists of mental health professionals. And the issue of cultural competence in mental health professionals is a big one. And so I think the biggest issue when you ask people about getting lists of mental health professionals is they're not culturally competent. We don't have anybody. So I think that one of the things you can start to do is, again, ask around. In the U.S., telehealth has become a much bigger part of mental health practice since COVID. So in New York, where I am, I'm a licensed psychologist in New York. I can see patients anywhere in New York with my license. There's actually some compacts out there that you can see people across state lines. And so you don't have to look for somebody necessarily in your town or your city. You can find somebody in other parts of the state or other parts of the country. And that, I think, has made it easier. I'm seeing agencies start to share names of people that have been vetted by the agency. And I think, so again, I would ask around. Specifically on the issue of cultural competence, I think the gold standard is someone who's both clinically competent and culturally competent. If you've got someone who is clinically competent but not yet culturally competent, but they're interested, I think help make them culturally competent. I would much rather you as an organization find someone who's a really good therapist, let's say, but doesn't know a lot about first responders, because we could teach that person about first responder worlds. Have them come on some ride-alongs, invite them to the open house, have them sit in on some meetings, so they learn about that learn about what it means to be a first responder, emergency service provider. There are some formal trainings out there that start to get that. So I think the next best thing, if you can't find someone who's both clinically competent and culturally competent, find someone who's clinically competent and help them to become culturally competent. Because as a mental health professional, I don't have to know everything about the jobs and lives of every one of my patients to know how to help them. Knowing more about what their worlds are like is obviously important and helpful. But again, patients, the organizations themselves can teach that if they need to. But besides mental health professionals, other professionals, especially if you got people getting injured, are there good occupational therapists out there, physical therapists out there, massage therapists, for people who are having physical or other kinds of injuries, are there other professionals out there that have kind of been vetted as good? Some of this may be, one of the obstacles I see is, besides actually finding the people, is, hey, that's great, but I work the overnight shifts. I don't know a lot of psychologists and mental health professionals, therapists that work at 3 a.m. So that may be an obstacle. Timing may be an obstacle. And again, the other one is primarily finding lists of vetted professionals. Those are your main obstacles for there. And then, once you've got these all in place, you circle back. You sort of iterate this. As I said, culture is probably the slowest moving piece of all of this. And I think you should always be assessing your culture. But go back through and you started doing some mental health monitoring. The results of that monitoring might tell you that you need some different initiatives. Right? So you cycle back through. This is the framework that once you put in place, that mental health or that behavioral health director or whatever you're going to call them should be in charge of kind of helping cycle through this process regularly to make sure that you are responding to any changes in the organization, responding to stuff that you're seeing in the organization, and really moving you forward and not only just keeping you in place, but moving you forward. Right? So that's that last step. Reassess and iterate. If this is going to be an integral part of your organization, it needs to be looked at regularly. And stuff is going to fall apart. You're going to put things in place that just don't work, and you try something else. But you can't do that unless you're kind of thinking about this as an ongoing process. right? I have to say this again. It cannot be a one and done process. You can't go through this once, any piece of this, and think you've done it. You can't just check a box and feel like it's done. It has to be an ongoing process, right? Every step of it. So expect some resource issues, right, as you're doing this, both financial issues and manpower issues. Hey, we can't get anybody to join the peer support team because they're already stretched too thin. You know, again, we can't find a list of good therapists in our area, so that's at some level a manpower issue. The main thing that I see, you might expect some of that mistrust and cynicism. You know, that people aren't sure until they really see the organization has to put their money where their mouth is. They might be a little suspicious or not really. They're going to hold back a little bit at first to see that if you really mean it. Hopefully, those will start to fade with time, and you can manage some of those resource issues as you go through. The last place where you see some issues are, like I said, around that behavioral health director and kind of power fights that you might see happening, authority, people stepping on people's toes as part of that. So again, things to watch out for. And as a finish up, just the whole reason for putting this together is that behavioral health issues, I think we're really starting to see in first responder and emergency services worlds as being really some of the main issues facing us, and they really deserve to be a priority. So instead of just thinking about this as, like I said, these sort of isolated projects or programs or initiatives, think about to make this sustainable, making it an active and integral part of your day-to-day operations, right? This is really going to take effort, time, and money to put this stuff in place, but it is really worth it to do that. And I will finish with this QR code will just take you to my email address. I am happy to talk with anybody who's watched this video about any of the particulars of this, help you walk through this process, help you talk you through how to do an audit, some of the implementation steps. Feel free to get in touch with me. I would be happy to answer any questions that you have, work with you. This stuff is really, really important to me, and I want to make sure that you can make your own behavioral health programs really systemic and sustainable for your own organization. Thank you.